Resuscitation can be defined as the preservation or restoration of life by the establishment and/or maintenance of airway, breathing, and circulation. This section is a quick review of the basic procedures required to perform cardiopulmonary resuscitation, CPR. When treating a person suspected of suffering respiratory failure or cardiac arrest, you must always remember the key principles. Danger. Check for dangers and hazards to the rescuer, bystanders, and the casualty. Response. Assess the level of consciousness of the casualty. Airway. Open, clear, and maintain the casualty's airway. Check for signs of life. Breathing. If casualty is not breathing, commence rescue breathing. Compression. If no signs of life, commence CPR. Defibrillation. Attach defibrillator as soon as available and follow its prompts. Whenever you come across anyone who has collapsed, you should always check to make sure that neither you, the bystanders, nor the casualty are in any danger. Check for hazards such as electrical wires or chemical substances and remove the casualty from the cause of danger or the cause of danger from the casualty. Remember, your safety is always important. Check for danger to yourself, to bystanders, to the casualty. To check for response, first talk to the person by shouting a simple command and then squeezing the shoulders.
Can you hear me? Mate, can you open your eyes? What's your name? Can you squeeze my hands? Hello?
If the person is conscious, there will be some response. Continue to monitor the airway, breathing, and signs of life, and provide aftercare. If the person is unconscious, the rescuer must move to the next step in the DRA-BCD action plan, airway. If there is a bystander available, they should immediately telephone for an ambulance. In all cases of resuscitation, obtaining medical assistance is essential and should be made an early priority.
Oh, mate, excellent. Can you go and get an ambulance first of all? And then on your way back, get the defib from the staff room?
If the casualty is unconscious, leave them lying on their back. There could be a blockage to their airway causing problems in breathing. The most common cause of blockage of the airway is the tongue. Open their mouth. Look for a blocked airway. Tilt the head back and support the jaw to open the airway. To apply head tilt, place one hand on the forehead and one hand on the chin using a pistol grip. Once the airway is open, you will be able to check for signs of life. Signs of life include consciousness, breathing, and movement. Place your ear near the casualty's mouth and look for any breathing movements of the chest and abdomen. In the case of drowning-related incidents or known airway blockage, the casualty should be positioned on the side. Open their mouth. Look for a blocked airway. Remove any foreign objects from the mouth by scooping with 2 fingers. Tilt the head back and support the jaw to open the airway. Once the airway is open and clear, you will be able to check for signs of life. If breathing is absent, the rescuer must move to the next step in the action plan, breathing. Maintain the head tilt and chin lift. Give 2 rescue breaths in approximately 5 seconds. To give rescue breaths, take a breath and open the mouth wide. Seal the nose with your cheek. Blow until the lower chest starts to rise. Turn your head, placing one ear near the casualty's mouth. Watch the chest falling and listen for air leaving the mouth and nostrils. Remember to look, listen, and feel after each breath. You can see on this mannequin that ventilation must be strong enough to ensure that air enters the casualty's lungs, pushes down on the diaphragm, and expands the chest. There are 2 other methods you should learn: mouth to nose and mouth to mask. With mouth to nose, the general steps are the same as for mouth to mouth, except the thumb closes the mouth when breathing in and opens it to allow the breath to come out. Mouth to mask can be used to give rescue breaths without direct face-to-face contact. Maintain the head tilt and chin lift. Press both thumbs down on the mask to provide a seal. Quickly assess the casualty for movement and responsiveness. If there are no signs of life, the rescuer is required to commence CPR. The lower half of the sternum should be compressed during chest compressions. Historically, the caliper and index finger techniques have been used to locate the point of compression. However, it may be more time efficient to locate the area visually. The lower half of the sternum is effectively the centre of the chest. Compressions are performed using the heel of the hand only. Place the heel of the hand on the lower half of the sternum. The fingers of the hand should be pointed across the chest and exerting no pressure on it. Place the other hand over this hand and hold it by either the finger holding or wrist holding method. The compression must be vertical and the pressure applied only through the heel of the hand onto the sternum. The sternum should be depressed to 1/3 of the depth of the chest. You can see on this mannequin the correct compression location and the depth of the compression. For a child, you need only use one hand for cardiac compressions. For an infant, use 2 fingers for cardiac compressions. Give 30 compressions followed by 2 rescue breaths. Repeat the cycle in a rhythmical manner. 5 cycles should be completed in 2 minutes. Continue until emergency services arrive or you have access to defibrillation.
Thanks, mate.
Defibrillation is the process of stopping an abnormal heart rhythm using an electric shock delivered via an automatic external defibrillator, AED. An automatic external defibrillator is fully automatic, that is, no decision is required by a person.
Peel white pads from grey plastic case. Attach pads to bare skin exactly as shown.
An AED has easy to follow instructions contained within the machine. Follow the instructions and voice prompts.
Stay clear of patient. Analysing heart rhythm.
Remember the chain of survival. Early access. Call for help as soon as possible. Early CPR. This will increase the casualty's chance of survival by encouraging oxygenated blood flow to the brain. Early defibrillation. The restoration of adequate heart rhythm is necessary for the casualty to survive cardiac arrest. Early advanced cardiac life support to stabilise the casualty.
Look, there's someone out there. I think we should help him. Come on, let's go. Wait, check for danger.
Danger. Check for dangers and hazards to the rescuer, bystanders and the casualty.
Hey, are you alright? Can you hear me? Are you alright, mate? Wait, lift your head if you can hear me. Oi. Are you alright? Oi, come help me!
Response. Assess the level of consciousness of the casualty. Airway. Open, clear and maintain the casualty's airway. Check for signs of life. Breathing. If casualty is not breathing, commence rescue breathing.
Is he breathing or what? No signs of life. Call the ambulance, quick!
Call for help as soon as possible. If there is a bystander available, they should immediately telephone for an ambulance. In all cases of resuscitation, obtaining medical assistance is essential and should be made an early priority. Compression. If no signs of life, commence CPR.
Ambulance is on its way. Oh, good.